Do you have high blood pressure, or do you take many pills for it? Now the question is, wouldn't you want to control it without medication? In this video, we will discuss the treatment of high blood pressure even without medication. And if you follow this advice, you may never need to take medication or possibly even get off some of your pills. Now, 76.4 million Americans over the age of 20 years have hypertension. That roughly comes to around 30% of the population, and only half of those being treated actually have it under control. And as many as 8% have undiagnosed hypertension. Now, you would agree that hypertension is a common disease, but it is very, very dangerous. It can lead to heart disease, strokes, and even vision loss. Now, wouldn't you want to bring it under control naturally? Now, it may not be easy, but it works. And if anyone tells you that there is a magic formula, that is incorrect. Like with everything in life, if it is too good to be true, it most certainly is not. But by following these basic guidelines, you can make a monumental improvement in your health and your quality of life in general. Now, you need to have some goals in mind. Either lower your blood pressure and keep yourself from getting high blood pressure in the first place, or reduce your need for blood pressure medicines and thus not take any blood pressure medicine at all, or make medicines for high blood pressure work better for you, or just lower the chances of a heart attack, stroke, or for developing kidney failure. Now guys, the purpose of these videos is basically for the public to know about high blood pressure, and happens ever so often that the physician may not have enough time to go into details of your health issue, as everyone everywhere is facing some sort of a time crunch. But still, our health should be our primary concern, and through these videos I want to keep the dialogue going and for people to share their experiences, for all of us to learn more about ourselves. And when we learn and understand, we act better and take care of ourselves. That's the basic idea. Knowledge with practice always leads to improvement. So now, controlling high blood pressure. This has all to do with improving the way you live. Let's start off. Salt restriction. Numerous studies have shown that reducing salt or sodium in your diet can decrease your blood pressure. Have to keep the sodium intake to less than 3 grams per day or even less. Always keep looking at those labels on those boxes and always check their sodium levels. The most important thing that you can do to cut down on sodium is to eat less processed food. That means that you should avoid most foods that are sold in cans, boxes, jars, etc. and prevent further issues if you already happen to have heart failure. That happens if your heart disease goes crazy. Now, weight control is next. Losing weight is so potent that it is independently associated with a lower blood pressure. And even if you don't exercise and basically lose your weight by controlling your diet, it still helps. Combined with salt restriction, this could have a huge impact on our blood pressure readings. Now, theoretically, for every 1 millimeters of mercury decrease in blood pressure, you get 1 pound lost. Now, that could translate into much better control of your blood pressure. 5, 10, 15, or even 20 pounds lower blood pressure. And along with that, you will feel much, much better and lighter and get rid of your pills. Now for your waist, keep watching it and control it. Studies have shown that just having some extra inches can put you in a lot of trouble. Having a flat belly is always good, but to put it in numbers, for men, greater than 40 inches is a risk factor, and for ladies, more than 35 inches gets you a risk factor for high blood pressure. But keep it well under control. Who knows what studies will show tomorrow? Anyways, next is exercise. Aerobic exercise and possibly resistance training can decrease your blood pressure, and this is regardless of any weight loss that comes with it. Basically, 3 or 4 sessions per week of moderate intensity aerobic exercise, going for approximately 40 minutes, and if you continue that for 3 months, you will definitely find results. Let's give it a try. And if you want to be active, you don't have to go to the gym. It is possible to increase your activity level while doing everyday things that you do enjoy. Gardening, dancing, walking are just a few things that you might try. Now, next is the DASH diet, which basically stands for Dietary Approaches to Stop Hypertension. The DASH diet is high in fruits, whole grains, vegetables, low-fat dairy products, poultry, fish, nuts, and it is low in sugar-sweetened beverages and sweets in general. And they also avoid red meats. The DASH diet is rich in electrolytes such as calcium, magnesium, and potassium. Also, it's high in protein and fiber, but it's low in generally harmful ingredients such as saturated fat and cholesterol. Now, combine the DASH dietary pattern with sodium restriction, you will have an additive effect. Now, peer pressure may help. Joining groups where you can talk about your problems can actually help. Members can serve as sources of positive reinforcement and could also provide helpful tips for your own circumstances and guide you in exercise programs and helps you try new and healthy dietary options so you can keep the discussion going at your own pace and with a company that you enjoy. Now, next, you got to cut down on alcohol intake. The more you drink, the higher your risk for hypertension. A woman who consumes more than one alcoholic beverage per day and men who have more than 2 drinks per day are at a much higher risk of hypertension than non-drinkers. Now, decreasing alcohol intake lowers blood pressure. Now, having said this, some people are great at making up their mind and then sticking to it, come whatever may. But most of us are not like that. So we have to take slow steps and constantly work on making everyday work for us in reaching our goals. The key to improving our habits and lifestyle is to start low and go slow. Choose a single, small, specific aspect to alter. Keep doing it until it becomes a habit. Let's say, for example, that you would like to work on your diet. If you're the type of person who eats pizza and French fries all the time, don't try to get rid of it all at once. When people try to make big changes and sudden changes like that, they cannot maintain it. Then they feel frustrated on the failure. So instead of a sudden change in everything in your diet from day one, work on 1 or 2 small things about your diet and give yourself time to get used to those changes. For example, keep the pizza but do away with the French fries. Or cut your portions in half while eating the same things and supplement with a healthy alternative. Keep on working on it, and day by day you will notice yourself eating healthier and feeling much better. You will begin to trim down your waist and will realize that this actually works. This will surely be a learning experience and you will explore yourself and be amazed at what you previously thought you can never achieve, but will not only achieve it, but also love your new self. Slow and steady will win the race right here. So now the take-home messages: reduce salt, become more active, drink less alcohol, lots of fruits, vegetables, whole grains, lentils, chickpeas, some nuts, almonds, peanuts, low-fat milk or fat-free milk. Make portions out of our meals. Yeah! My friends, I feel that it is achievable, and not for only ourselves, but for our families and our loved ones. Anyways, click on the subscribe button to get the latest info on health-related topics, and do share your experiences and thoughts, or any struggle for yourself or your family. I would love to hear your story. And always keep in mind that your doctor's goal is to prevent you from taking medication. But if you have to, you must take them properly. My friends, stay healthy and stay safe.
Oh yeah!